Welcome back to my channel. Today we are going to talk all about dental implants. So dental implants are titanium based metal structure that's placed into your jawbone as a replacement of your missing natural tooth. So if you have an infected tooth or if you have a failed root canal treated tooth or a fractured tooth that is beyond repair, your doctor may opt to have the tooth removed and replace them with a dental implant. So then the other options that you have, well, you have access to a removable partial denture and also a fixed partial denture. Removable partial denture is comes with a big base plate and metal wires. It can be annoying and discomfort in chewing food and difficulty in speaking. Then you have the fixed partial denture, which is attached to the tooth in the front and back of it. Or if one of the tooth fails, then the whole bridge is lost. So that's where the dental implant has gained in its popularity. So the procedure is simple. The doctor removes the tooth and places the implant at the same visit. Or if the tooth has been lost, the doctor opens up the gum, drills a hole into your bone and places the implant. Once the implant is placed, the bone should heal around the implant. It could take 3 months, 4 months before the crown can be placed. Now there are exceptions. Exceptions are like the doctor, if the bone is lost, there's a lot of considerable amount of bone lost, then he may have to build the bone up and wait for considerable amount of time before the implant can be placed. If the doctor is comfortable, he may place the implant and also the crown at the same visit. It will all come down to the case that's at hand and also the conditions that the doctors are trained under and also the demands of the patients. So if it's, say for example, if it's a cosmetic side, like one of the front tooth is missing, so the doctor can have the implant placed and the crown done all at the same time. But it will also subjected to the stability of the implant. If the implant does not if the doctors does not get the sufficient amount of strength from the bone, he will not place the implant. The reason is if the crown is placed over the implant and if there's a lot of movements of the implant, it can lead to its failure. So once the implant is in place, you will and the crown is done, you will have to visit the dentist on a regular basis. This is to ensure that the implant really does last long. So if there's any food trap around your implants, it can lead to gum infections, which can ultimately end up with failure of the implants. So regular visits to the dentist is mandatory to make sure that your implants will last you a lifetime. I hope this video was useful. I'll be back with more. Do not forget to like, follow and share for more. Thank you for watching.